Welcome to the lecture Introduction to Rehabilitation for the Savma Symposium 2021. I would like to start with introduce myself a little bit. My name is Rob van Wessem. I'm from the Netherlands. I was born in 1962 in Amsterdam. I went to Utrecht University, that's our main veterinary college, the only veterinary college in the Netherlands. And I finished that with my DVM and also Masters of Science in Veterinary Medicine. The first 6 years in practice I was in a mixed practice, small animal as well as equine. Equine was a lot ambulatory and also some in clinic. Small animal was really just a small animal clinic, so a lot of work like everybody does in small animal. In 1996 I thought that was enough, and driving around all day didn't really fulfill my ideas and ideals, so I started the Equine Sports Medicine Clinic, one of the first clinics focused just on sports medicine in the Netherlands. And we really got cases only in our clinic. What was very helpful to really develop that kind of sports medicine. In 2003 I also got an appointment as a director of the Animal Science Center for the Dutch National Police Agency, in which I was involved in all the procedures regarding canine and mounted units within the Dutch police. In 2005 I emigrated to the United States to become a professor at Michigan State at the McPhail Equine Performance Center. I was really focused on equine sports medicine and rehabilitation. In 2009, when the economy started to turn down, I started my own practice again, now in the United States, Equine All Sports Medicine Center, focused just on equine sports medicine and rehabilitation. In 1999 I got my board certification in equine medicine from the Dutch Medical Association, and in 2014 I became a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. When you look in the Oxford Dictionary what rehabilitation really means, or what the description for that is, then we can read there: the action of restoring someone to health or normal life through training and therapy after imprisonment, addiction or illness. And we can use that same definition more or less for our animals. Other than that, I don't think many of them will be in prison. However, some of our horses are quite often locked up in a cage for quite some time a day. I don't really know a lot of addicted animals. I think we're more, as people, are addicted to our animals. And illness, that's clearly something that happens with small animals and horses, or any pathology that needs to be rehabbed. For a lot of people, when you think about animal rehabilitation, they think about the fancy clinics with in-ground pools for horses, or smaller pools for dogs, to do a lot of exercises in water as a tool to get them into a better stage, better condition, or like real rehabilitation after an injury or something like that, and to try to restore that function. In real life, it's not also always that fancy. Rehabilitation also quite often is doing special exercises. For dogs as well as for horses, there are a lot of exercises that can improve the condition of an animal, and they can be helpful in rehabilitation of a variety of problems. You see two pictures, one of a dog standing on specific pillows, making it a different sensation for the dog to stand, what could really help for rehabilitation, especially when you want to get better proprioception. The other picture shows you the stretching of a front leg of a horse, and what could really help in stretching certain muscle groups in the shoulder and in the neck. This picture shows you a water treadmill, and we have water treadmills for dogs. We also have water treadmills for horses, and the use of that is that first, especially if you immerse the animal a little bit more, like this picture, or even a little bit higher up, then the water will take away a little bit of the weight on the limbs, and that could be a very good tool to get animals to, with a lesser weight, still move. More newer research even has shown that The level of the water, if you make animals move on that treadmill in the water, the level of that water really has an influence on how legs are used. Quite often if the water is a bit lower, we get a little bit more lifting of the legs, what implicates some more flexion and extension of the lower distal limbs. While if the level of the water gets higher, then quite often you train more core muscles in the higher part of the body, and we get a completely different motion pattern when we talk about swimming. So really good and unfortunately also quite expensive tools for rehabilitation. For horses, we have all kinds of fancy tools too. Here we see a solarium, what's used in a lot of barns, fancy barns for sure, for just normal warm-up for horses or after work to give a nice warm-up of the back muscles. But in rehab, they can also have a function in before doing some certain exercises, making the muscles already at a little bit higher temperature, what it makes it easier for those muscles to stretch and contract than when they were cold. So again, a nice picture of a fancy tool used in rehabilitation. This picture shows you a common exercise tool with rehabilitation in horses. We call it the carrot stretches. Horses seem to like carrots. A piece of sugar quite often works too. And by moving that treat just out of reach, you can make a horse flex its neck in all different kind of positions and with different ideas on which muscles or groups you stretch, mobility of the spine. Very, very helpful tools in rehabilitation. And what's nice of this can be done without fancy machines. This is a thing you can teach an owner to do, and they can do that at home as part of a complete rehabilitation program. When we talk about animal rehabilitation, one of the most important things we try to do is we want to restore function. Function from a certain tissue, function from a certain extremity, function from the entire animal. And to do that in a proper way, we need to have quite a lot of knowledge about physical processes, physiological processes, but also about the pathological processes. A really important thing at first is to be able to determine the location of our main problem. Because if you don't really know where your problem is, how do you think you're gonna fix that? And when you look at this all above here, what I think is really important to realize is like we as veterinarians are perfectly equipped to help in this process. When we're thinking of restoring function, one of the first questions we have ourselves to ask is, why did it fail in the first place? Sometimes an injury is a result of a traumatic event, falling, slipping. Animals can do all kinds of things that can really injure them. On the other hand, a lot of failing of function is a result of repetitive stress injury. We see that especially in horses a lot. There are a lot of specific exercises people want to exercise with the horse because it should make the horse better. And that could be in dressage, could be in jumping, could be in nearly any discipline. But if that's done in an improper way or in an overextended way, too often, too long, then you can get a loss of function just because of a repetitive stress injury. What is a different way of failing than after an acute trauma. And how did it fail? Did it break? Did it tear? Did it get an irritation of a nerve? Is a muscle damaged? Important things to know. We also need to know a lot about the compensatory mechanisms. What happens if a certain function is not good anymore, a certain limb is not working? How is the animal going to cope with that? And what kind of mechanisms are possible in that animal to deal with that or to cope with the problem that's going on? When we want to restore a function, we really have to deal with the initial problem first. And that quite often means we need a treatment plan before or as soon as we have a rehab plan. And that treatment plan can be medical. We can give all kinds of medications to animals to deal with an initial problem. We can also have a surgical intervention, what quite often is a good tool to quickly improve conditions and then follow up with rehab. And we have all kinds of additional treatment. Think about acupuncture, just to call one of them. For rehabilitation, we need to go through the appropriate process. The first thing to do is to know the location and the origin of the problem. We call that diagnosis. When we have a diagnosis, we should have a timely sequence for the initial treatment and the rehabilitation plan. And very often they overlap. In the past, quite often initial treatment was like rest, medication, maybe surgery, but then waiting until that was done and then starting with rehab. Well, that's old-fashioned. The newer ideas are that you start as soon as you can within rehabilitation. People in the hospital now, quite often when they just are out of surgery and start to come back to normal, there's the physiotherapist at their bed to tell them to get out of bed and start to do certain movements. And that's for sure a thing that we start doing more and more with animals too. Don't wait too long for rehab, but start as soon as you can. Also really important is to have a proper follow-up. Follow-up can show you where you are, how the animal reacts to our adapted or our protocoled program. And then the important thing is we can make adaptations to our rehab program when needed. Sometimes not every animal follows the rules. We can have very clear protocols for how we should do rehab, but it's important that it's just a directive. It gives you an idea. But if during the rehab you see that certain adaptations need to be made because the animal is not reacting properly, we should be able to do so. It's not a star and rigid program. We have to be really able to adapt when needed. As I mentioned before, we start with knowing where our problem is and what it is. Diagnosis. When I start a case in my practice, we'll always start with a good history. I'll sit down with a client for 10-20 minutes and we go through what happened, what their problem is, what they think that happened to the horse, how they dealt with it until now, if there's a history of similar problems in the horse, all those things. And to me, especially when we have a more complicated case that needs a rehab, it's very, very helpful to know a lot more about that case and the patient, and also know a little bit more about the relationship patient and owner before we start the whole journey through treatment and rehabilitation. I'll get back to that later too, but it's important to get a good idea what the owner expects from you and what the owner, how his life together with his animal is. After the history, we'll go through a full physical exam. And that can cost easily up from 20 to 30 minutes. It's really helpful to get a good physical to know where our problems are. And it very often gives a good indication where to focus all our efforts later on, diagnostic-wise as well as rehab-wise, so that we get the full picture. Then after the physical exam will come with additional diagnostics, very often imaging, radiography, MRI, CT. We by now have a lot of options for motion analysis. A lot of lab work can give us more information on what's going on, etc., etc. A good diagnosis might take quite some time, but it's a really good start of any rehab procedure. It's very good to realize the diagnosis is really the start of the entire process. And it's your best chance of a good outcome when you have a good start. And the more you know about an animal and its full condition, and what all can be of influence on your outcome, the better it is. Think, for instance, of an animal with Cushing's. What will really have an effect on how good muscles can react on training or on rehab. If you're not aware of the Cushing's, you might end up with a not very helpful rehab plan because you focused on creating better muscle power, but because of the underlying problem, you didn't really get anywhere. To me, what's really a good factor in this whole process is explain, explain, explain. I explain a lot to my clients why we have to spend quite a lot of time on a good diagnosis. Especially when they come to a rehab vet, quite often they think it's just for rehab. And if I have a completely worked up case with very good images and very good diagnosis, I can do that. But in case we have a not so clear-cut case, I better start with a good diagnosis first before doing all the other things. It's worth the investment in the beginning, financially as well as just in all our efforts, to get the best result at the end. For a diagnosis, we quite often need specialistic procedures and specialistic knowledge. We can use all those tools also when you don't have them yourself. We don't always have in our arsenal of tools good radiography or ultrasound. For sure, not everybody has MRI or CT or motion analysis. So it's not a bad thing to refer when needed. What we see more and more, especially in small animal medicine, is that we get centers with many specialties in-house. And so a case goes from specialty to specialty. And often in such a location, rehab is a specialty. And they work with the results from what surgeons found, what internal medicine people found, maybe what nutritional people found. And you get a combined effort, a team effort, that really finally will get your animal in the best shape at the end. And rehab is just part of that. Here you see a picture of in-house radiography for a horse. This is not the kind of equipment you bring to the barn to make a quick X-ray of a horse. It's really additional information that you often might need to refer to a facility when you have no options yourself to have that in-house. And radiographs, especially in equine medicine, are very often the first imaging tool that we're going to use before we go any further to determine what's going on. Here you see an image of an MRI for a horse. This is what we call a standing MRI, meaning that the magnet is just around the leg of the horse. The horse is not under anesthesia, but just a little bit sedated, stands quietly with his foot in the magnet, the blue thing you can see there. Advantage is that the horse doesn't have to be under anesthesia. Disadvantage is that it's only working for the lower limbs. You cannot put a higher part of the body in it, or a head, or something like that. Then we need to go for full body MRIs, or at least larger MRI machines, and the horse needs to be under anesthesia to be able to be imaged there. Small animal radiology quite often is much more easy to do, even in a normal practice. Nearly every practice has now digital X-ray equipment available, and it's very easy to make a couple of images from your animal. And good radiographs can be a very, very good tool to start in the diagnostic process and get a good idea of all the things that are wrong with your animal before you start bringing up a rehab program. Here we see an image of an MRI for small animals, and as you can imagine, the bore, the opening where the animal goes in, is big enough to get the entire animal in there. It needs to be under anesthesia for sure, but we can really more or less image any part of that body if you want to do that with a small animal. And imaging really helps us to give a complete picture of the situation. Here I'd like to give you a little insight on which veterinary specialties we have at the moment. The American Board of Veterinary Specialties has recognized quite a long list of veterinary specialties, and they can really help us in the process for rehabilitation. A lot of specialists can help us initially to go and help with the diagnosis. They can maybe help us with initial treatment for surgery or internal medicine if something needs medication for a while, neurology, oncology, very important specialties that are can be of any help for us. And then the one that sticks out to me when we talk about rehabilitation is the American College of Veterinary Sports Medicine and Rehabilitation, what knows an canine and an equine certification, and those are the people that are specialized in rehabilitation for dogs and horses. And talking to you students, it's always nice to realize that there is more than just going into practice when you get out of college. And when you want to go to become a board certified specialist, quite often after maybe going into practice for a little bit, at least you need 1 year of internship, quite often with a practice that has somebody working there that is a specialist in that college that you want to go to. Then after that you get a 3-year residency before you can be eligible to take the exam to become board certified. Some of the colleges do have an alternative path, what means that you don't have to be a resident for 3 years, but they have an option to combine that in practice, sometimes even in your own practice, and doing some stints of shadowing specialists in different fields, but finally will make you also eligible to take the exam. In general, an alternative path takes longer because, yeah, you can imagine it's not as focused as when you take a residency, but there are different options to become a board certified specialist. And I would encourage you all to look into those options before you decide to maybe just go to general practice. An important factor in any rehabilitation is pain. Pain quite often is generated when we have tissue damage. The damaged tissue will release inflammation mediators in that area, what for instance will excite neurons of the type 3 neurofibers, what makes the animal sense pain. Pain by itself, it's not nice when an animal is in pain. But when we talk about rehabilitation, it has a lot of really more important side effects. What happens when we or an animal is in pain for a certain region? Quite often you get an altered motion activation pattern for that limb or part of the body that has pain. And it can already occur after a couple of hours or days with some pain that we get a completely altered motion pattern. Some research in people showed that people that damage their patellar ligament, what's a ligament that sometimes get injured by runners, especially marathon runners, and when they damage that, as a result of pain generated by that damaged tendon, their activation pattern of the quadriceps is changed. And as a result, they start to move different, their leg is moving different, and when you even would fix the tendon and you don't change the altered pattern, they will always move differently after that. But in general is at least not as effective as before, and quite often has a lot of side effects in overexerting other regions of the body. And so when we talk about pain, we really have to got a handle on that before we start rehabilitation, because if an animal is in pain, in general the rehabilitation is not going to be very effective or not very much as planned. What are muscle activation patterns? Well, they are patterns of certain motions caused by muscles, but they are coordinated in the brain and they become automatic patterns. Think about that of driving a stick shift. Don't know how much of you still know how to do that, but when you initially start driving a stick shift, you have to really juggle with the clutch, let it gently first push it in, put the gear in the right gear, then let the clutch come up, and at the same time start to push on the accelerator. And that's a lot of different motions, and you really have to think about it when you start doing that. And that's when you see those cars shuffling over the road when that pattern is not perfect. But after a while, quite often, a couple of weeks, months, years, depends on how much you drive, it becomes an automatism. You can do that whole process without thinking about it, even when talking, doing other things, being on the phone. it's a thing that becomes like an automated pattern. When the beginning you still have to think about it, but when that package of motions is set into motion, it's an automatic thing. And we talk in neurology about that in central pattern generator. What's the circuitry that acts on each limb during locomotion, and it activates the flexors and the extensor muscles alternately. Really in a nice program, in a nice useful way of moving. You can imagine if the flexor and the extensor muscles are at the same time firing, you don't have a lot of motion. So it's activated in the brain. A lot of people call it muscle memory, but it's a thing that really is originating in the brain. A muscle memory is a thing that goes through repetition. You have to do it a lot of times before it becomes a pattern. And it has to be exactly the right way. If you constantly move a little bit different, it's not going to be the same motion pattern that you activate, so it takes really long. Even if you do it in the proper way, it needs a lot of repetitions before it becomes a stored pattern. We talk in generally about 10,000 to 20,000 times. And when it's a more complex movement, it can take even much more. That's really important to realize for rehabilitation. If we're going to use a certain exercise to try to alter or to try to modify an altered motion pattern because of an injury, we need to have many repetitions. Otherwise it will never happen. And that's sometimes difficult to understand for an owner too. It's not a very quick thing. It can take a long time to get to 20,000 repetitions. And that's again a good thing to explain to an owner when you start with a rehab plan. It's not as easy as giving a pill and it's fixed. People need to show quite a commitment to get this done. And explaining those things up front so that you can explain why it takes longer is really going to be helpful on the longer run, because the people know why it took that long to get their animal back to normal. Initial treatment is what we do as soon as we think about having a problem, but for sure we do that before we start rehab. And very often it's anti-inflammatory. I talked about pain, about inflammation, and that in general is inhibiting good rehabilitation. Now we can also talk about the effect of pre-treatment. And we know that before the longer pain exists, the more difficult it is to treat. So sometimes when animals are, you can wait for them maybe to be injured. Sometimes it's helpful to upfront already think about some treatment in anti-inflammatory or pain medication at least. Important another thing is try to do no harm. Sometimes initial treatment is so focused on just initial treatment that we can make it harmful on the long run. Again, my point here is that pain will block or modify any mode of physical exercise, so we have to fix that before we start an exercise program. If rehabilitation is focused on an exercise program, we want to have the animal not to be in pain. When we come up with the rehabilitation plan, we have a couple of phases. We have the initial phase, what most cases is to get the animal mobilized again. Let's make an example again of an injured joint. When that joint starts to get better range of motion again, that's the thing you want to do as soon as possible. Certain injuries, especially when we talk about tendon injuries, they might need some immobilization first, and then we talk about all kind of taping and things like that, what could be part of a rehabilitation plan too. Gradually we increase the mobilization, and what we generally do, we gradually alter the muscle activation patterns, or we modify the altered muscle activation patterns. That's maybe a better way even to say that. And then we re-evaluate that effect and make adaptations to the program. And that's a nice thing of being a vet in rehabilitation. You will see your cases quite a lot. You need to help them through those different phases. You need to have a good feedback what's going on. And that's what really makes it, to me, such a a nice specialty to be working in, you see your animals a lot. You see them improve, you help them improve, and you get a good feedback on what the effect is, what you're doing. And that's for me a big plus above what I did when I was more or less driving the fire department from case to case in equine practice, fix something, and you maybe never saw that animal back again. Rehabilitation is much more involving, and it's to me much more rewarding than a lot of the other work you normally get in general practice. It's also good to realize with a rehabilitation plan, thinking about what kind of tissues are involved, because there is a really different time for tissue to fully recover. In skin, quite often you see in 10 days and a simple skin injury can be healed. Bone quite often heals in like 6 weeks. A tendon and ligament, you talk about 6 months to a year. And nerve damage can take over a year to really fully recover. And the rehabilitation program should be really focused on that time that you need. And it could be completely different when you just have like a broken toe or severe nerve damage. You see that the rehab program, the rehab time can hugely differ based on which tissue is damaged. After all these more theoretical slides, I like to show you a bit of this entire process, what it means in real life with a simple example. And it will give you an idea how important basic veterinary science is in the process of rehabilitation. So when you're as a student, even earlier in your education, sometimes it looks boring to go through all that basic science. But then realize how important that basic science is in your later life as a veterinarian, and especially when you want to be involved in rehabilitation. You need to really have a good understanding of basic principles of veterinary science. And then they're fun when you can make them to help you in healing animals. For my example, I would like to go for a joint. And we have a bit of a schematic draw from a joint where we first will go through the different components. In black here we just have the bone that makes the end where we have two bone coming together. In this picture in blue we have the synovial membrane, so it's really the inside layer of the joint. It's going to produce the synovia, the fluid that will lubricate the joint and will give the nutrients to the joint, and it's really the inside layer, the most inside layer of the joint capsule. In red we have the joint capsule. It's like connective tissue, same kind of tissue as tendons and ligaments are made of, only far thinner, a little bit more flexible, and it keeps all the joint structures together. At 2 or 3 areas quite often in the joint capsule is thicker and may quite often get in those areas than the collateral ligaments. That's the same kind of structure as your joint capsule, just more dense and more concentrated on one area. And your collateral ligaments will limit the amount of motion of the joint and will give a certain direction of the motion into the joint. Now it becomes more interesting. We have now brought in here the muscles, and in this joint we talk about a more distal limb joint where we have only muscles on the proximal part of the joint, but you can imagine in other joints that can be a different picture. The muscles really are the structures that will give the joint its motion. By contracting on one side, they will make the muscle shorter, and when the muscle is attached to the bone on the other side of the joint, it will move the joint. And the opposite muscle is doing exactly the opposite. That's what we see here in green. Tendons from the muscle connected to on the other side of the joint connected to the bone. So when the muscle at the left side here will contract, it will move that part of the joint to the left, and at the same time the other muscle has to give some relief and some relaxation to make that motion possible. And that's why we talk about the muscle activation patterns, where it should be very coordinated when one muscle contracts and when the other muscle relaxes to give a full range of motion, or to stabilize a joint. When both muscles have some tension, they will perfectly keep the joint stabilized. That's a very important function from muscles too, stabilization of a joint. In this picture we finally have most of our structures in here. In blue, sensors or receptors. They're in different areas around that joint, telling the brain tension of the muscle capsule. It will tell the tension in the joint capsule. It will give information about stretching of tendons and ligaments. And in the bone there are also quite often sensors. In the lower limb are sensors. They all give information to the brain where the position is of that joint and what happens. This is where it becomes interesting in rehab, because what we could do with rehab, I like to go again for the example of a joint problem. Let's say we have some arthritis in this joint, and as a result of that arthritis, if this joint could move around 70 degrees without any arthritis, we'll now have some thickening of the capsule. We'll maybe even have some changes at the edges like spur formation, leading to less flexible joints, say 65 degrees. As long as that joint stays in the 65-degree range, quite often the process of arthritis is going to be quite stable. It's when we overstretch that joint and go back, try to get it to the 70%, that's when irritation of the joint capsule starts to lead to more blood flow through the joint capsule, what we call capsulitis. Quite often the inside layer of the joint, the synovium, becomes inflamed, what we call synovitis, and as a result we get more fluid in the joint, quite often from a lower quality, less viscous, less nutrients, what will really deteriorate that joint if it goes on like that. What we could do with rehab, when we talk about the initial treatment of a joint, say that that joint is really inflamed, it's very painful. As a result, both muscles will try to stabilize that joint, make it really stiff. And when we talked about mobilization as one of our first efforts in rehabilitation, is that as long as this joint is stiff and it's not moving, there will be less nutrients diffused through your synovial membrane to these parts of the cartilage. So on the long run, that's going to give more and more deterioration of your cartilage and more osteoarthritis. When we start to help those muscles to relax a bit, when we start to help this joint being less inflamed, we have a start of rehabilitation. Initially, quite often, NSAIDs will help to get some inflammation reduction in your joint. Ice, especially when it's a joint that's accessible for cooling this area, that will really do a job too. And quite often veterinarians will inject something into this joint, which could be a corticosteroid, it could be one of the more newer products that do some inflammation reduction by autologous products in there. Idea is the same. We want to reduce the amount of inflammation here so that the trigger through those sensors to the body to keep this stabilized and keep this stiff, that trigger should be reduced. As soon as that works, we can start to help those muscles to relax a bit. And when there is more relaxation, and quite often we talk then about passive motion, when you gently start moving this leg here, especially when it's not painful anymore, otherwise the animal will tell you that he's not happy with it. But when it's not too painful anymore, you can start to move this, and by moving it one direction, you will stretch this muscle, what quite often will help in releasing some spasm in here. You will release this area when you flex this joint in this direction too, what will help in normalizing tension in this part of the joint. So mobilization techniques are quite often the first step in rehabilitation. That first will maybe be just passive motion. When we went through the first phase and the joint starts to really cool down, we can also have active motion, and that's quite often all kind of very specific exercises. It could be a treadmill, it could be swimming, it could be hand walking with a horse, it could be walking with a dog on a short leash. All those different ways of making a very specific way of moving. When we went through that first phase, when everything starts to become more mobilized, if you would stop there and the animal would go back to its work, whatever it's doing, very likely it might go back to overflexing this joint beyond this 65-degree normal range of motion that we had talked about, and the whole process starts again. When we do a really good rehab, what we're going to do is we're going to alter the motion pattern here. We're going to tell those muscles to keep this joint within that 65-degree. And when we train those muscles to be stronger, it will be easier for those muscles to keep the status quo, to keep a normal range of motion in here. And so in the advanced phases of rehabilitation, we really focus on exercises or tools, machines, like again when we talk about treadmills, things like that, where we can make those muscles stronger so that they're better prepared for stabilizing this joint. We also can increase the endurance of that muscle. You can imagine what will happen with a muscle when we work, and initially those two muscles are strong enough to keep this situation under control. When we start to get a little bit fatigueness in the muscle, in general because there's some storage of lactic acid, in an extreme case we even can get half this muscle being completely out of glucose, and as a result that muscle gets fatigued and cannot really contract anymore. You can imagine when that happens, when those muscles start to get weaker, their stabilizing function of this joint is clearly less. And that's where we have a really important part of our rehab, when we train those muscles not just only to be stronger, but also to have a better endurance. The animal is better equipped to work a little bit longer in the same setting as it did before without damaging this joint again. So even when we talk about joint problems that we cannot really return them back to normal, we can quite often restore function by stopping the process and making the conditions around that joint in a better way so that the animal can better deal with it. That's the fun thing from rehabilitation. We can really make that animal do a better job than before, instead of just stopping arthritis with an injection and some medications and leave it at that. What you see here is just a bandage around the dog, and initially you can think maybe that's because it has a wound, but we can quite often do that for making a certain joint a little bit stiffer, adapting the movement in another part of that limb, and helping initially to alter a motion pattern. And sometimes we don't directly go back to trying to restore the normal motion pattern. We might even do something else in another area to relieve a certain part and have some extra result on that later. Here you can see a technique of taping, what we can do in dogs as well as in horses. And the idea on that is that we trigger a lot of those specific sensors that are in the skin here. And when that horse starts to move, it gets more signals from the sensors and can, because of that, alter its motion pattern. And there are all kinds of taping techniques. Taping in horses is not to like limit the motion of a joint. A lot of sport taping in people. What you do is with taping, you're more or less limit the flexion or extension of a joint. That's not going to work with a horse. What you do with this is that you give it an altered sensation through some of the receptors here. And that helps you in modulating the muscle activation patterns in this region. So this could be a good tool for horses with some neck arthritis. This slide might be maybe the most important slide of my whole presentation. It's about compliance. Compliance means the level of acceptance of the owner to do what you propose, to do what you ask them to do. Hand walk this horse for 6 weeks. Don't let your dog jump off the couch and only have short walks on a leash with the dog close next to you. Those things make or break your rehab. When people don't understand what you want them to do, or you ask them something to do they clearly think they can't, it's not going to work. And realize the main factor you are going to be judged by a client is how finally the effect is going to be. They will not really realize they didn't do what you are asking them to do, and they only will see that it didn't work and that must be your fault. So in my practice, one of the most important things here is the communication. I really like to sit down at the end of a complete workup with the client, and every evaluation of a rehab I'm going to sit down with them and I tell them what our goals were for the last time, what we're going to do for the coming period, and why. What I use in my communication is also communication I got from them. When they tell me, when I sit in my interview, in my taking my history in the beginning, and they tell me the horse is at a boarding facility and they live 20 miles away. They go once a day to just ride. I know for sure if I'm gonna ask them to hand walk that horse 3 times a day, that's going to be difficult to get compliance on that. And so you have to come up with plans, rehab plans that are sometimes suboptimal, but you have to adapt them to what your owner can do. And you have to be very clear in your communication about that okay, what I'm going to tell you now, I have, let's give an example. I have 2 plans, I have 2 options. One of them is you do this and this and this and this, and it looks like you're going to have the best effect, but I understand that's maybe impossible in your situation. So I have option 2, what maybe will take a bit longer, might not get the optimal result, but still very effective, and it's more likely that the client can deal with that. And so we really need to make this an important part of our rehab to really realize that we need to come up with a couple of advices, a couple of rules, a couple of things they need to do that they really can commit to. And we really need to understand the client's situation, and that's per case different. That's why this specialty is also so interesting, because in my equine practice I see certain injuries quite often, and my standard rehab would be more or less the same. But every case has a little difference in approach, because what the client can do, what they can do with that horse, what the horse can do. Some horses, if you walk them every day 3 times a day, they will just follow you and do nothing wrong. Another horse, after 3 days is done with that, will rear, will kick, will play, will do all kinds of other things that make it impossible to do that with that particular horse. And so this part again of our rehab program or our rehab process is really important to go through. Address problems, be clear. I always, and that's maybe a bit more easier from somebody for Europe, they always tell us that we're a bit more blunt, but I like to just mention that to them, like, yeah, I can imagine this is a problem, but without this, or when you do this and this, we have those and those side effects. So I give them options. I explain what kind of things can go wrong when they do it a different way. I also need to think about what to do when compliance seems low. And when people go home after my first visit or the second visit and they tell me they can do it, and they come back and I don't have what the result I was expecting, I need to figure out why that is. And very often it's compliance that seems low. And then I need to adapt my plan for the next phase, because if I keep on going on the same way, I'm not going to go anywhere. This is really, if people like you and come back, that's helping you build up a practice. And compliance is a very, very, very important factor in that whole process. Here an example for a horse. We want to activate that hind leg of that horse a little bit more. But I know that the rider is not such an accomplished rider, so she cannot really get that. So I can tell her, like, well, you need to become a better rider and get your horse more engaged. But I know for sure it's not really going to work. When we go for another solution where they can lunge it with a certain tool, with like an elastic line behind the hind leg, what can help them to get a little bit more control on that hind leg while on the ground and lunging that horse, it's much easier. Also, when this horse, for instance, had some back pain, and in his initial phase had been bucking a lot, and the owner is really afraid of getting on that bucking horse again, if I tell them, okay, now you need to go on your horse and make him work harder, I can see in their eyes that they look at that moment when I would tell them that, like, you're an idiot, I'm not going to get on that dangerous horse anymore. And so you have to pick your games every time and think what would work in this situation with this condition of the animal and with this skills of the owner, what would be the best way of addressing our rehab. And to me, that's one of the biggest challenges in this profession. It's also the biggest fun, because you have to be very creative and come up with funny plans. And here you can see a commonly used way of helping a dog with some problems in the hind end. The towel around the hind end, just in front of the hindquarters of the dog, and then when they go out and walk, they more or less lift the dog, and initially they really make it quite strong, and you can instruct the client that over time they can pull less and less, and at the end the dog is just walking by itself. Again, simple tools, but you have to explain. You need to figure out if the people are capable of doing that, all those things we mentioned before. The final outcome is the overall result of all the factors and circumstances that you encountered. It starts with the diagnosis, and you've seen which processes in getting a good diagnosis are already really of essential value. And then it goes all the way down until the end when people want to see that their animal is better and that it fulfills their expectations again. Each factor has a specific value or influence level. And I mentioned already, like in my practice, in my ID, diagnosis first, correct diagnosis first, communication through the whole process, and compliance are really, really important. But all the factors are playing a game. And the final result is what counts. The final result is what the client thinks like, wow, I'm really happy with that. And they go on Facebook and tell that your practice is great. And they tell other people you should go there. Or they tell, wow, I spent a lot of money and 5 months of rehab and my animal is still where it was before. That's quite often not the client that's coming back. Important to do is do a back check. Check where you are, reality check. You can do that during your the whole process of rehabilitation, at the end for sure. But you want to see if this is what I expected, and if not, why? Was my diagnosis not good? Do I maybe need to go back to my diagnosis and look again if things have not changed? Is compliance a factor? Did I not explain well enough what they have to do? Or I've seen that for a boarding facility. I give you an example. I told people hand walk the horse twice a day, stall rest and no turnout. And the people thought that happened, but at the boarding facility they had no time for that. So they put the horse just out and told them that they were hand walking it. And so sometimes that, if not why, is a process you have to be a detective and figure out why didn't we get the result we got or that we were expecting. And then you have to adapt your program. Talk about what went wrong. Try to help them out how to improve that. And sometimes do a couple of steps back and say, okay, we might need to go back to checking a couple of things from our initial plan diagnosis, or maybe from our second plan, our initial plan of rehab. Things are dynamic. They're never static. We work a lot in protocols because that helps to give some direction, but they're not too rigid. We need to be able to adapt when reality tells us, because animals are all individuals. People that live with those animals are completely different individuals. It changes every time what you can do with it. Well, I hope I gave you a bit of an idea on what rehabilitation is, why it's quite an interesting field in veterinary medicine, and I'm really, really happy to take any questions you have.